everyone. Thanks for tuning into my video. I just wanted to make this for Lyme Disease Awareness Month, which is May, and I am hoping people will take my video and my experience with Lyme and educate themselves and educate others, because really prevention is key. For those of you who don't know what Lyme disease is, it is an acute infection caused from a bacteria-carrying tick. So the tick bites you and transmits a bacteria that is corkscrew shaped. The bacteria enters your blood and multiplies. It then drills into your organs, central nervous system, brain, joints, bones, tissues, and muscles. It pretty much drills itself into anything it wants to inside of your body, which in turn causes a variety of symptoms, which is why Lyme disease often goes misdiagnosed. I have had every symptom there is, and yet the doctors diagnose me with everything but Lyme disease. That's the thing about Lyme. It mimics all other diseases, and people are often misdiagnosed with fibromyalgia, Alzheimer's, Parkinson's, MS, chronic fatigue syndrome, lupus, arthritis, depression, schizophrenia, and much more. They go on suffering and become chronically ill for the rest of their lives. Some die. Even blood testing is unreliable and produces false negatives. That is why clinical assessment of symptoms should be used in diagnosing Lyme disease. It is the hardest disease to diagnose and to treat. That is why prevention is key. Doctors are in denial Lyme exists in Canada. This is due to the fact that Canada's testing methods are unreliable to confirm the diagnosis. So cases go unreported and doctors continue to be uneducated. Ticks can be as small as a poppy seed and often go undetected. If you're lucky, you may get a bullseye rash, which is a key indicator of Lyme, but it is only present in about 30% of cases. If this disease goes undetected, it can become chronic and make a person extremely ill and bedridden possibly for the rest of their life. The sooner caught, the better and faster chance of a full recovery. I went 6 months misdiagnosed, have been on antibiotics for 5 months, and I've been sick for 10 months straight, if not longer. I am still suffering from debilitating bone pain, fatigue, headaches, and dizziness, etc. If you catch it early, like within 2 weeks of being bitten, 3 weeks of doxycycline will cure it. If you're not so lucky, your life will mainly consist of a bed, a bath, and all these pills. So if one day you have severe joint pain, doctors will just tell you to take ibuprofen and glucosamine. And then one day you become severely vertigo, like I was, like I couldn't stand, I couldn't walk up the stairs. I hadn't been that vertigo from something that wasn't self-inflicted, like drinking. Like I knew something was wrong. So I went into the ER and they diagnosed me with an inner ear infection. So they gave me these pills and they did not help. And then if you start having strong shooting head pains, crushing chest pain, falling sensations, tremors, and migraines, and your blood work, CT scan, and heart tests come back normal, you'll probably be diagnosed with anxiety and be given Ativan. If one day you start vomiting so hard you puke up blood and break blood vessels in your eyes and your face, you'll be diagnosed with depression and given antidepressants, which might actually make you depressed. You may start to develop migraines and be given strong head pills such as these, which make your head feel like 100 pounds. And then they might refer you to a neurologist who will schedule an MRI, which if you do have Lyme, you'll probably have multiple superficial brain lesions from where the bacteria entered, and it will show up as white matter, which I had on my MRI brain scan, which can in turn later down in life result in MS. So if you start having shooting pain throughout your whole body, fatigue, headaches, joint pain, sensitivity to light, you'll probably be diagnosed with fibromyalgia and given Lyrica and a whole lot of pain meds. And then if one day you become tired of suffering and all these diagnoses that don't make sense and taking pills that don't help you, you actually might do some research of your own in hopes of finding a cure for this nightmare and actually getting your life back. That's what I did anyways. I did some research on all my symptoms, which pointed straight to Lyme disease. I read how Canada testing is inaccurate and produces false negatives. So despite a negative test, you may still have Lyme disease. Knowing that, I purchased the Hygienics kit and sent my blood to the States to be tested for Lyme, which came back as positive. Even with a positive Lyme test, the doctors were still reluctant to treat me. They said I should be tested positive in Canada. But I was so sick. I was tired of waiting for proper treatment, and I insisted on getting the antibiotics. I was given 3 weeks of doxycycline, which in my situation was not nearly long enough. I had yet to go see another doctor in hopes to attain more, and I won't get into the controversy with doctors treating Lyme in Canada, but if you're interested, there's a book I purchased called Ending Denial, and it goes on to explain the controversy in Canada of Lyme disease and why doctors won't treat it and fear of losing their license, and how they go for these guidelines, and yeah, it just goes on and on. It's pretty much based on all about money. The government doesn't want to pay for Lyme treatment because it's very expensive. But yeah, if you're interested, I can lend it out to you or give you some more information. I could try post a link of where you can buy the book. It's $40. It goes to donation. Yeah, so if you're interested, you can look in my notes. Maybe I'll have a link. But if you do have Lyme disease, you're unfortunately looking at a lot of pain rubs, like deep heating for your joints and bones and muscles, compresses, hot compresses, Voltaren, joint roll formula, Tiger Balm. I've gone through like 2 of these. Lots of Japanese like oils and stuff for your head, and this prescription pain rub, which is really expensive, and yeah, lots of baths with Epsom salts, saunas, massages, chiropractors, anything that really helps, like physio. I was going to physio and it was just too much, but yeah, just anything that helps. Like, I find the painkillers don't even touch the pain. Lots of these gel packs and these magic bags. And you're also looking at all these antibiotics here, which kill your immune system. So you'll need to be on all these supplements here to support your immune system. And you'll probably have to be on sleeping pills because you'll be in so much pain you'll be unable to sleep. So I have Zopicon and Unisom. And then you will probably looking at thousands of dollars for treatment if you don't treat this early and properly. And you'll probably have to go to the States for treatment unless you try find a naturopath who's willing to treat you, but it's going to cost you. And you're also going to be disabled, so you'll be unable to work. So your money, income, everything is gone. Like, I'm on short-term disability, which runs out in June. I've been off since December, so I've been off 6 months. My disability is running out. I'm going to have to go on unemployment because I'm not better. I still have really debilitating bone pain. I thought I was getting better. I was even out running a few days, which I was so thankful for. And I was so thankful for each day because I felt like I was getting better, but I've relapsed and I'm having pain again, and it's just it's no fun. There's no way I'll be able to work. But I'm hoping soon, because I don't think EI is going to be able to cover my mortgage payments for much longer. And your quality of life will just be taken away just like that. Like, I went from being completely healthy and active to being bedridden, like, in a matter of months. I didn't know what was going on with me. Like, it's the worst crazy disease. Like, you have such crazy symptoms, and they're so, like, different from each other that you don't know what's happening to you, and it's scary. It's very scary, especially when the doctors don't know what's going on either. So it's really something that you got to be aware of, and that's why I made this video, because I think people would rather watch a video than read about it, and I'm hoping that the video can just be spread around and you can make your family and your friends aware, so they don't have to suffer. So why go through all this when it can be prevented? Awareness. Just be aware. Like, all your suffering, can be prevented. Be smart, because ticks don't discriminate. They'll bite anyone. Like, they'll bite anyone's blood. They don't care. They'll suck on your dog and then come into your house and fall off and bite you. So check your dogs. Check yourself after you've gone camping. Like, if you're one of outdoors people and you love camping, be sure to check yourself for ticks. Especially if you're in BC. That's where I think I got my tick. And check yourself, because it can really save you years of suffering.